that he could maybe a great ENT doctor, but if he doesn't have the right equipment, so he cannot give the right consultation, because it's very important to know whether it's just edema, is there a hemorrhage, is there bleeding in the vocal cord, is there a polyp, or is there just everything is normal and it's just anxiety of the patient. I think one of the best things that we can do as experts is that we can help these patients to relax. And I think it's very important. The best thing that what I really like to do when such a patient comes to me acutely, like a few hours before a show, it's the best thing for me is to tell him everything is just okay, everything looks great, and you can go on and perform. And I can be much more confident about this diagnosis if I have the right equipment. And sometimes if such a patient goes to a general ENT doctor, doesn't have even a fiber optic examination, just doing the regular examination, he may give him steroids, which was already told before. It's not always the best solution, on the contrary. And I think in general, it's very important for artists to see their vocal cords at least once. And we encourage them to come to the clinic, as we say, in the days of peace, like not in an acute emergency situation, but come in peace times when everything is fine, just to see, to get a contact with a laryngologist, get to know a good laryngologist, have a good exam of your vocal cords, see how they look, see how they function. So when you come again in some bad times, there is also always something to compare to. And I totally agree with Dr. Tali Landau-Zemmer that said that even if there is a pathology, we don't read the pathology. So many singers have nodules, edema, have varices, some of them have sulcus, and still they perform 100% good. So it's our job is to differentiate between what is important and what is not important, and we have to be there for the artist.
Very true. Thank you. There, someone said, Dr. Lav, המרגיע הלאומי. Okay. So thank you for so much, and I didn't present you properly. Dr. Yonathan Lav is a director of vocal cord units in Asuta Medical Center in Tel Aviv, and he is the chairman of the Israeli laryngeal. Say it for me.
The Israeli Vocal Cord Society.
Yes, thank you. Which has just opened, right? It's all new. So congratulations.
Thank you.
And so I'd like to move the next question to Jacob Lieberman, who's an osteopath, psychotherapist, and he specializes in voice recovery. We talked a little bit about jaw and coughing, and you started mentioning just like Dr. Lav was just mentioning, the emergency, and also the mental emergency and how that can affect the physical body, and what people should know about the whole concept of the show must go on. Can you expand on that a little bit? Oh, you're muted. Let me change that.
The area of the larynx is an important junction, psychosomatic region with very powerful muscles. The example I'm about to give, if you want to stop a laughter or a cry, you know exactly what I'm talking about in terms of this feeling of a lump in the throat, pain, muscle pain, and so on and so forth. So, of course, the moment that anxiety sets in, whether there is vocal fold pathology or just the anxiety that something is wrong, that by itself is enough to close the larynx. I have a lot of clinical experience with just anxiety setting in So when you talk about, the general relaxation advice is to ascertain what is real and what is just anxiety. Therefore, if a singer is worried about the state of the vocal folds, the best thing is to see a laryngologist, a specialist, who will have a good look at the vocal folds, and he will have the facts. Knowing the facts by himself can help. And then, of course, not just the vocal folds are involved in voice production, you have also the coordination of breathing and the use of all the other muscles, which is the resonating system. So you really want to set everything in sync, as it were. So if somebody is worried, in my opinion, the first port of call is a laryngologist, just to give a good assessment of what is happening with the vocal folds. And then, of course, a good assessment, a physical assessment of the level of tension in the musculature of the vocal mechanism, and breathing, and reassurance. I mean, that will be I think, the order of setting up, a healthier state of mind before performance. I just wanted to also to say that when it comes to coughing, there is a much better, healthy way to cough, whereby you blow before you make the sound. That means that you're not going to slump the vocal folds together very powerfully. So it's exhaling in a powerful way, and only then to close the vocal folds will be much safer way of coughing.
יכול להדגים איך לעשות את זה?
Can you demonstrate the...
Yes, I mean, instead of just creating, let's say, from the Valsalva maneuver, instead of building up pressure like and explode, what you do you create a good airflow instead of exhaling powerfully, like something like that. And then to close the vocal folds, something like that. Instead of So you blow air and then you close the vocal folds. So you reverse the tendency of closure first and blowing second. I hope you understand.
Yes, thank you so much. And that's actually a really good advice. I can tell you from myself and from my clients as well, because I've learned it from you in the past, and it's so beneficial. People feel like they're reducing the pressure of the cough. So thank you.
And it's much more efficient because when you blow out, you clear. If you just create a big explosion, sometimes you push the mucus, the saliva, sideways, laterally on the vocal folds, and then this slides inwards again. Yeah. So that's the proper way to really empty and to ventilate your lungs.
Thank you so much. So useful. So I'd like to get one of our international guests and a very important person for me personally as well, Melanie Tamsin. It's hard to describe everything Melanie does. She's a speech-language pathologist. She's also a singer and a performer. She has so many different, how do you say, credentials. So I wouldn't even know how to start, but she is also representing the PAVA organization, which Voice Center Israel for the last 2 years is a chapter of Pan-American Vokology Association, and the reason why we are doing these type of events. And she's here to talk a little bit about the importance of collaboration again, but not only on the local level, also on the international level, what our organizations like PAVA are trying to do, and how we can use that to grow as professionals and as singers. So go ahead, Melanie.
Thank you so much. It's such a pleasure to be here. I'm so grateful to all of you for having me. My name is Melanie. Thank you for such a sweet introduction. As a singer, I for a very long time, looked for the right kind of information about how to optimize my voice. And then when I ran into trouble, I saw a lot of clinicians and, I mean, really wonderful people, but no one who understood what it was like as a singer when I went on stage. So in the clinic, I was a model patient. I did all the exercises. I was scoped every 3 months for a period of several years. But the truth was, when I went back on stage, everything just became problematic again. For all the training I'd had, I didn't know how to translate it. So when I became a speech pathologist, truthfully, I did so to find answers for my own singing voice. And I realized none of us, I see people smiling, I'm sure I'm not the only one who found myself down this road. But what was interesting to me was discovering that on my journey to find information, I was not alone. And I thought I must be the only singer who has ever experienced this before, because we never talk about these things. So I had met many different types of professionals, singing teachers, acting voice coaches, speech pathologists, laryngologists, all sorts of people, even more peripheral people to my journey, gastroenterology, looking at things like Alexander technique, and none of that gave me the answer I was looking for, which was, had we all been speaking together, and I saw someone make a comment about case managing, having someone in the center to help a singer understand what was happening, that was the piece I was missing. So when I started to practice, I found the part that gave me the most joy was kind of case managing, helping to translate for a singer what the laryngologist meant, or what the Alexander technique therapist could do to help, and bringing it all together in the center. And that's what I find that I love about PAVA and organizations that help us all work better together. It allows us the opportunity to collaborate, thinking about that voice user in the center. And we are all the people around that voice user, many of us voice users ourselves, and we have a lot to share, but we are stronger when we work together. So I love using an international organization of a variety of different types of professionals to better learn how to communicate, not just with our client or patient, but with each other, to better serve everyone that we're working on. So I love working on a team, and I love collaborating in this way, where we see different people from different aspects of voice coming together to talk.
Thank you so much, Melanie. Actually, I'm a little confused on what to do right now, because Ingo is supposed to be here. I'm genuinely a little bit concerned. I hope everything's okay. He's usually right on time. So we're trying to figure out where he is. But in the meanwhile, we'll just take a few minutes to ask just a question that came up earlier, just from anyone on this panel that wants to contribute. So just regarding the fact that sometime a singer could be a virus, could just not be a virus. They wake up in the morning and all of a sudden they don't have a voice. And they are not sure what the reason is. Can you tell us a little bit what some of the reasons can be, what some of the things that you can do when something like that happens? Why would something like that happen to anyone? Whoever wants to chime in.
Okay, I will start. First of all, you have to ask questions. You said the singer woke up in the morning without a voice. This is the scenario?
Yes, waking up in the morning and all of a sudden realizing no voice.
So first of all, just to make sure that they didn't do anything different the night before, just to ask him about any special performance or something that is not related to performance. Was he having fun? Was he going out in a very crowded, noisy place? Was he drinking? Was he smoking? Did he do anything which was unusual for him? So after excluding all this, again, ask about tension and anything that is, any emotional thing. Then, and again, this is a consultation that can take place by the phone or with an application like this one. As Peniina mentioned earlier, we are also giving remote consultations these days. It's very interesting that actually a laryngologist can also do a good consultation without examining the vocal cords. If you're asking the right question and using some common sense, sometimes you can really help the patient. And this is something that we will probably do more and more these days. Anyway, if this patient doesn't have anything urgent to do with his voice, then I would just wait for a few days to see what is going on. Maybe it's a virus, maybe it's an allergy, maybe it's stress, I don't know. If this patient is expecting to perform in the next day or hour, then he should be examined, even just to make sure that everything is okay.
Maybe if I may add, Yonatan, if you're done, or so if it happens from yesterday everything was okay and today everything is wrong, then it can't be something, usually too serious, like a polyp or vocal nodules. Okay, it will be something acute, and usually something acute will fall under a big category that's called inflammation. Inflammation in Hebrew is deleket. It can be an inflammation due to infection with a virus, for example. It can be inflammation that is edema from vocal overuse. It can be sometimes inflammation due to reflux, like Yonatan mentioned. So it will be some kind of inflammation, usually that causes swelling of the vocal cords. It can also be a hemorrhage. And that is why Yonatan's questions are so important. But usually a singer will know that he screamed yesterday or, had really extreme voice use that may be affected. So that's why usually, like Yonatan said, Dr. Lahav said, it will usually go away sometimes, most of the time by itself, when you do all the conservative things we talked about, hydration, vocal rest, and all these things, and then start gradually a warm-up, then usually it should be fine. But
I just wanted to add 2 words as a former singer to add to what Dr. Lahav said, to go in peacetime. Any singer who has a career should have their ear, nose, and throat doctor that's their person that they go to every few months to make sure everything is okay. Not when things get crappy, but that's part of their team that helps them maintain a good voice. And when something like this happens, then the doctor is probably going to have an easier time putting it into context. That's number 1. Number 2, there is this thing with singers having a performance and then going out to eat and drink late at night, and that's classic, and then waking up the next morning. Sorry, I'm not supposed to do that. So just to reinforce what Tali and what Dr. Lahav just said.
Wonderful.
If I could just say a word about the day after.
Yes, please.
Just say something about the day after. I think once, depending on whatever the decision was about the performance, the day after is actually quite important in achieving a good diagnosis, stress management, risk management, long-term. These are all things that we shouldn't be waking up in the morning and deciding on. These are things that there is the junction at which there must be decisions taken into account, but really thinking about the long-term effect of whatever decision has been made is actually, I think, also should be part of the process.
Aramut?
Yes.
You said, you began your question by saying the singer gets up in the morning with no voice. When I, as a speech language pathologist, hears no voice, it means to me silence, no voice at all. So if he gets up with no voice at all, I would ask him to do some vegetative voice, like, can you cough? I ask him or her if they can cough, because if they can cough, it gives me some kind of a differential diagnosis of something emotional or something, let's say, physical, pathological. Although, as Yonatan said, it can be also, if he also has a very bad voice, like maybe you meant that when you ask your question, it can also be, of course, something emotional. But not having voice at all usually takes it more to the psychological aspect. And this is an opportunity for me to also answer some, to expand something that, a question that was referred to Claudia. One of the teachers, I don't remember who, asked her if the singer has some kind of a psychological problem. Is a speech language pathologist, is he or she the person to refer to? Yes, only, but I think only if this singer has, he is in therapy already most of the time. So if a student has a psychological problem and he is in therapy, I think most of speech language pathologists that work with voice can handle the situation, or at least get into it. Okay. And if not, maybe I remember some cases that were referred to me because of problems singing. They were not my patients then, but I could help them. And I think also other speech language pathologists, voice specialists can help them a lot.
Perfect.
And thank you for the great convention. I would call it convention.
Thank you.
Yeah.
Thank
Worldwide
you.
convention. Yeah, thank you.
So I'm gonna ask Melanie to join me now because we're not sure what's happening with Ingo. We're hoping everything's okay. So we're gonna talk a little bit just to finish, to wrap things up. We're gonna talk about vokology and what it means, which is what I was going to ask him to say. Dr. Titz is basically the father of vokology. It's a word that came from him. Melanie, would you like to say a few words on that and what is vokology?
Yes, sure. Now, we typically define vokology as being the science of voice habilitation. So that could encompass anything from voice therapy to voice training to knowledge about voice. Vokology is a word that Dr. Titze sort of coined, but if we think of anything that has the suffix ology as being the study of, and then the prefix of voice or voco, then it's just basically voice geeks getting together and talking about voice enthusiasts. That's the way I like to think about it. I think it's a very unique term to this particular community, but ultimately I think it just means those of us who want to get together and talk about voice now have a word we can use that isn't specifically rehab or habilitation or training or therapy or medicine. It's voice and the study of voice in the center of all of us.
Yes, and in that word, I mean, when we study vokology, then we talk about some of the physics as well. And then suddenly voice disorders or a vocal production that is not, let's say, ideal, also brings about other points of view. I mean, not just the vocal folds themselves, not just the muscles, but also the aerodynamics and the air pressures that are building up below and above the vocal folds. And from your knowledge as an SLP, how does that manifest when it comes to a voice disorder when someone is not using their instrument properly? What does that mean in terms of using the air pressures and managing all that?
Well, in terms of air pressure specifically, it's, as we know, breath or air or fuel for the voice is one of the subsystems of phonation. So we have the breath that supports the voice, the vibration of the vocal folds, the way we shape the sound with our resonant vocal tract, and then the way we form the words into communication, whether it's speaking or singing or any other kind of utterance. the breath support or breath management is one component of that. And whether we are challenged with too much or too little airflow, too much volume, too little volume, too much pressure, too little pressure, there's sort of a range of things that can become imbalanced, and then a variety of ways we can get a person back to balance when looking at breath management or air management.
Yes. And when it comes to like flow phonation, which is like speaking in a bit more healthy way and allowing the air to flow and not having a compressed voice. So a compressed voice, to anyone who doesn't know what it means, it's just like something that's a little bit more squeezed. And if we want to have a little bit more airflow, so there's a whole concept of flow phonation, which is supposed to be more balanced and healthy. So for you as a singer, and I know you do belting as well. So does flow phonation kind of doesn't work for us anymore when we need to belt and we need to sing in operatic sounds and big, intense volume?
Yeah. Yeah, I think you're right. And so for me, flow phonation puts the vocal folds into a state of, instead of being pressed tightly together, just being relaxed enough so that just the edges are touching. And when we look at the open to closed quotient, we want to see a balance or maybe a little more open than closed in one cycle of vibration. So basically what that means is, instead of the voice being really pressed and being touching more than it isn't, there's a nice easy balance of sort of letting the vocal folds just vibrate, almost passively, letting them respond to the air that's going through. So when we teach this to someone who's having a hard time with an imbalance in their voice because they're working too hard or pressing too hard, we will often go in the other direction by starting with a really breathy, very overly flowy sound, and then reining that back in until it's a little closer to speech. And that balance in the middle, where Kitty Bertolini likes to talk about it as being almost like 1 degree on either side. So pressed can be just like 1 degree, a little too much pressure, and then confidential voice can be at 1 degree of too little. And that flow phonation is that sweet spot in the middle where there's the right balance of pressure and air flowing. But the truth is we need different balances of air pressure for different tasks. So if we want to be loud, we need more air volume. But if we try to do that with too much air flowing through the vocal folds, all the air volume in the world won't make our sound louder. So we need to adjust the pressure and adjust the air flow, and then adjust the volume underneath those vocal folds for the right balance. So in belting, I know that one of the things I see often, and we talk about a lot in singing training, and I'm sure you've all seen it, there are so many singers who take in too much air when they're trying to belt, because belting sounds loud. And we assume, much like yelling across a playground or yelling across a parking lot, that to make loud sound, we need lots of air. But if we're trying to manage lots of air in belting and we want to configure things correctly, we now have too much air, and now we're spending all our time kind of holding it back, which creates more pressure than we need for that task. So I think it is a delicate balance. I love flow phonation, but much like almost anything else in this world, it has its place, and that place isn't belting. Does that make sense?
Yes, perfect. Thank you so much. So I'm gonna let you just to say a few words about Pava so we can close the event, and we're gonna figure out if Ingo is okay and safe. Yes, I'm just gonna let you show us a few things about Pan American Vokology Association before we break this up, and thank all the wonderful people that came in.
Wonderful. May I share my screen for a moment?
Yes, of course.
Perfect. Give me one moment here just to get this started. This is very quick, I promise. But I just wanted to help people who are either new to PAVA or unfamiliar with what PAVA does get to know us a little bit better. So Pan American Vokology Association means across the Americas, and now we've gone further to include everyone in the world. Vokology, voice geeks, association, group of us. So you're all basically part of us already, at least in spirit, but we'd love to join you to be a member. Basically, it's a nonprofit organization of people who are across a wide and diverse range of voice interest areas. So we have professionals like singing teachers, acting voice coaches, dialect coaches, speech pathologists, singing voice specialists, laryngologists, people who study animal vocalization, researchers. If you're interested in voice, we would love to have you join us, because that's the whole goal, is to include as many different people and perspectives on voice so we can have these amazing conversations. And the mission of PAVA is to advance the scientific and interdisciplinary study of vocalization, and we include it across species, because we're learning so much from animal models and bird calls that there's so much rich research in voice outside of the human population that we want to make sure that, again, we're studying voice, not just human voice, but voice, and how does that contribute to everything we know about human vocalization as well. The mission is also to foster vocology in countries we consider it to be in the Western Hemisphere, but now with the Canada and Eastern Hemisphere region, it's now everybody. And it's through research, training, and dissemination of knowledge. So it's a little bit of everything. We also promote the creation and development of professional standards and credentials in voice habilitation. And one of the big and exciting projects that PAVA is doing is creating a registered or recognized vocologist designation. Because for those of us who really focus in voice, it can be hard to express that in a profession for myself like speech-language pathology. If someone is looking for the right speech-language pathologist for themselves, I'm very limited by my regulatory body in terms of what language I can use to describe my practice. I can't say I specialize in voice, but that's what a singer would want to know. So PAVA, recognizing that there needs to be some sort of way to identify those of us who spend a lot of our extra time in voice, to be able to communicate that, is working on a designation. So that's really wonderful and exciting, and it's many years in progress. We're getting close. And we also support currently established credentials in voice rehabilitation. So that's not to say that we're creating something in PAVA that will now supersede anything that laryngologists or speech pathologists or anyone else has, but to be used in tandem with and alongside things that are already happening, and building on those things to allow us to be the best kind of professional for voice users. We do have a symposium coming up. It will be in Minneapolis, Minnesota at the University of Minnesota School of Music in August. At the moment, it's still planned to go forward, but we do know that things are rapidly changing and many events are being reconfigured, we'll say, sometimes canceled, sometimes repurposed. So we have a backup online plan already in the works. It will happen either way. We either will have one another together in person in some format, maybe sitting 2 and 3 chairs apart from one another in August, or we'll go online, or a combination of both. So either way, we're intending to have a wonderful symposium. We have many amazing presentations, even from our last year, because unfortunately, our symposium last year was in Santiago, Chile, and civil unrest canceled it 3 days before it started. So we have, I know it's been devastating. So we have made a point of inviting everyone who was to present in Santiago to come and join us again. So this is going to be a huge event. And in leading up to the symposium, we're having a series of online webinars and forums, 1 to 2 each month from now until August, that we'd love for you to be able to take part in as well. Membership is, compared to almost every other association I'm in, very inexpensive. If you just want to get in and see what it's like as a non-voting member, it's $50 American per year. So it, as an association, is quite affordable, especially if you just want to see what it's all about. You can learn more about the symposium and other events we're doing on the events page here at our website, pavavocology.org. And I am so happy to talk with all of you about anything voice related, in particular PAVA related things, but I'll take anything voice. And you can reach me at Canada@pavavocology.org. That is not meant to exclude the rest of the Eastern Hemisphere, just in recognizing that typing Canada and also the Eastern Hemisphere was a long email address. And I am in Canada. So feel free to reach me at canada@pavavocology.org. I would be so happy to talk to you about anything that interests you or help you understand if Pava is the right place for you. If you're here, I promise you it is, and we would very much welcome having you.
Amazing. Thank you so much. And it's really an honor and a pleasure that the Voice Center Israel that was established by myself, Dr. Tali Landau-Zemmer, and Pina Arenthal, and joined us later, Moria Or, managed to be a chapter for Pava. And I'm so glad that this is happening, that events like these are happening, and that we're all getting together. So there are so many people to thank. I'm not going to do all the names right now because it's too much.
Let's start by thanking you for organizing and being all the motor and energy for all this amazing collaboration, really, this year.
Thank you so much, Tali. It means a lot for me to do those things. It means a lot to be with everyone here, and to see everyone just, I just ask and people are like, yeah, let's do it. They just, everyone were excited. So it just shows how much we're all passionate about what we're doing. And yeah, I hope there will be many more events, and just thank you, everyone. And we'll keep you posted, and everything that if we didn't get to answer, we're going to follow up. We'll send you an email. Thank you for coming. And we'll send you some follow-up answers so you didn't miss anything. Thank you again so much, everyone, and have a good night. Bye.
Thank you so much.
Thank you,
so
Melanie.
much.
So wonderful to see everyone.
Bye-bye.
Wonderful.